Welcome back to Midday. Dr. Hunter joins us. How are you?
I'm good, thanks.
Good. Enjoyed your time off?
Yes, had a good spring break.
Excellent. And now you're back to work.
Back to work.
Back to the serious stuff.
Yeah.
It's getting warmer.
Spring's here.
It is, and it's like came so quickly too.
Yeah, a little early, I suppose.
Yeah, so ticks are out and about and just killing animals right now. Not literally, but...
Not they're killing them, but there's lots of ticks.
It's pretty bad.
Yeah, we have lots and lots of ticks at home. We're out of town.
Yeah.
And I'm sure that people are finding ticks. And as we talked about last time about identifying ticks and what we think is up with ticks, in general terms, just preventative medication is easy to do, and the new ones are very effective. There's several types. They're out here in front of me. There's the ones we typically will use, one of these. And that kind of manages to avoid the whole thing by killing ticks before they can be on long enough to cause any changes in the animal.
Right, and they can get on dogs, cats, anything.
Horses.
Every type of animal.
Cattle,
There's
deer.
Nobody that they discriminate against.
Yeah, they don't care. They just like to suck blood.
Yeah, exactly. So the medications that you've brought in as well too. Well, let's take a picture.
So there's a Rocky
first.
Mountain tick.
Okay.
A wood tick, and they are the ones we typically have here. They cause the paralysis when a female is feeding and releases a neurotoxin that will put a dog, paralyze them while they're on.
Wow.
They recover typically spontaneously after removal, and then it's okay, but it's easier just to avoid the whole thing by putting the medication on. They begin to suck blood, they drop dead.
Right.
So very quick action with the medication, and it's a monthly treatment. With one of them a 3-month treatment, once a monthly. It's all relative, really, when you get into it, and there's reasons to do one or the other.
Right. And so these are the most common ticks that we'll find around?
That's the typical tick in this area. There are some soft body ticks that are up higher elevations that I never quite keep straight, but this is the important one. And then, yeah, there's a comparative one with an engorged tick, the big one, and an unengorged tick, the little one, and that's a pair of tweezers that you're looking at holding it. So they're very small, right?
Right.
And they go through those larval stages you saw on the side, and removing them use these little instruments that are usually provided at vet clinics.
Right.
And that's one way to get them off, but it's easier just to avoid them.
Right.
You know, modern medicine's great.
Exactly. And so is this, the medication, is it preventative right away as soon as you start using it?
I think so. I can't remember the exact time of onset, probably a few hours.
Right.
Yeah,
That's
very
excellent.
quick.
And so is it still, I remember when we were doing it with our dog as well, we don't even do it anymore, he never goes out. But we used to, is it just the drop on the back of the neck, or there's different?
These are both oral.
Oh, okay.
The Advantix is a spot-on thing, and the other two are chews that you give them, and then they just are absorbed through the GI.
Oh, nice. And then it kind of just lets out something that...
It's just circulating in the blood, and if they suck blood, they get the toxin. It's toxic to them and not the mammals, and then they die.
Nice. That's excellent. That's better than having to put that drop on the back of their neck all the time.
Yeah, it's like you suck, you die.
Yeah. And plus, you know what, I think you remember you said this last time as well, with the older medications, like those ones, it would only sort of take care of a certain area, not the back end and the tail and all that sort of stuff.
That's the advantage of these new ones. They're more all over the body treatment. Anywhere there's blood, the drug is there, whereas with the older spot-on ones, we're not quite as extensive, and the collars are not nearly as extensive, so they could have them on the other parts of the body.
Right.
So that's ticks. And you know, we discussed the Lyme disease problem and prevalence of the black leg ticks in this area, which is not high, or maybe non-existent, we think. But that's something that may change, and so it's easier to avoid it just by treating. Right. As far as our animals go.
That simple,
I can't
just giving them
say
an
what to do
pill.
with people.
Right.
Just keep the tick, take it to your doctor, they'll speciate it and check it.
Exactly.
That's the best plan there.
Yeah. So the model that you've brought, is that one of the ticks as well?
Yeah,
It's in our area?
In the model, the tick is the flat one, much larger than life.
Right.
And
thankfully.
And because of the way these drugs are, this is a flea, of course.
Right.
So that's a brown dog flea, I think it is.
Right.
And we don't have fleas here, typically. You might get them at the shoe swap or some of the damper areas. They could get started, but they don't last the way they do at the coast. So that comes to the next topic of discussion, I suppose, which is spring brings traveling and camping and all the rest. So, you know, it's hard to predict everyone's traveling and what they'll encounter. If a person knows where they're going in the province, we can give you some ideas about things you might have to worry about with your pets, such as fleas at the coast or in some of the damper areas around, more in the interior. Ticks, of course, at the coast. Blackleg ticks are more common, especially in the Gulf Islands and up there where Lyme disease is certainly prevalent. And in eastern Canada, ticks and fleas. So some areas, you know, you have both these things. That's why they're together on that little model. And that would be the coast. And so down there, you treat for everything, and it's great. You avoid all that. Up here, we kind of are in this little hub of nothing, and you don't have ticks. We have ticks that are a problem, but not as big a problem, and we have no fleas. If you go south into the Okanagan, you run into another problem, heartworm, which is a mosquito vectored problem that lives in the bloodstream and is a big problem again out east where they have everything. And so they have ticks, fleas, lice, you name it. But so if you know where you're traveling, you kind of plan to do preventative medicine for all these things, which is kind of what the drive is across most of North America, is to avoid these things. And especially in areas where they're a big problem, like eastern U.S., eastern southern Ontario. Those are all big problem areas for a lot of these things. Here we kind of live happily in our sunshine and don't have an awful lot of trouble, right? Ticks. Just ticks for a couple of months.
So. All right, well, if you know where you are heading for your summer vacation, all the info on the screen for you there. Get a hold of Dr. Hunter, and any problems that you may have your pets, any ticks and all that sort of stuff.
And we support the Blazers.
Yes, go Blazers. Hopefully they win tonight. Thanks so much for coming on.